For your viewing pleasure, my green screen, it rolls up and down. The old, what did I used to call this? The political game show. Remember the political game show? I did that for maybe a month. Didn't really pan out too well. I started a different YouTube channel for the political game show. But there's the old suit, and I wore that for the John Kim video of Litecoin, OPA Litecoin style. So I'll tell you, when I'm in my closet these days, I'm not playing. I'm really here. Gotta go a little higher. A little higher, Snip. Okay. And which side is that? Here we go. Little twist. Little twist. There we go. You know, sometimes I just can't help myself. I just gotta do it. Gotta do a video on this topic I thought I was done with. Yeah, I'll leave it alone. Again, this should be the final one. And this kind of goes in line with the Penny Kelly thing. The third week, how the people, you people respond, you're standing at the door to your future. There's basically a choice over here and a choice over there. Which one you choose will determine your future. Have a nice day. She's like, I heard it loud and clear. Exactly 3 weeks from now. That's this week, people. Today's Monday. It's that day. And it's the 25th. Let me just unplug this little charger real quick. Every now and then the old laptop battery needs to go down. Let it go down a good bit on battery, then plug it back in, let it charge, instead of leaving it plugged in all the time. So I think about that Penny Kelly thing, and like I said recently, you know, I think maybe it's just going to be, are we going to stand for the lockdown stuff? Are we saying F you? We're going out. I'm going to the beach. I'm doing what the hell I want. I'm opening my store. Leave me the F alone. And the more I see, like, again, I'm on patrolling Twitter, and I'm seeing the videos and the protesting, and basically the protest is, we're going to the beach. Leave us alone. Now, look, Governor of North Carolina, I think it was North Carolina, Democrat. Oh, look, he's out. Not social distancing, not wearing a mask. He's got photo ops going on. Is that on my Twitter real quick before I get into this article? Oh, Beto O'Rourke, that moron, goes after Greg Abbott, which is the Texas governor, for reopening Texas. Ted Cruz and Dan Crenshaw slam him. Of course. Of course. So, I don't know how far down this was about the governor. Oh, there it is. Here it is. Let me show you. You know, since we're on the topic. Virginia. Oh, Virginia. I thought it was North Carolina. Virginia Governor Northam on the Virginia Beach boardwalk. No mask. No social distancing. F you, peasants. Do as I'm the governor. I can do this. You can't. You shut your business down while I continue making my salary as governor, because I'll never stop making my salary. It always comes in. There he is. Oh, wait, there's more. There's more. Before, oh, well, he could be social. Oh, whoa. I'm not done yet. Give me a second. Oh, photo op. Boy, you guys are awfully close to some strangers here. Here's another one. There he is. A lot of people standing really close by. Oh, can I have a selfie? Yeah, sure, no problem. Step right up. Again, do as I say, not as I do. Which one was? A little green screen action going on here. Let's see a little closer or what? The closer you get, the further I fall. They'll be after your businesses in no time at all. The deep state's falling faster and faster and faster. Let's get back to this. Again, this is not... I love when I have the ultimate source of information. Because the YouTube Gestapo is on standby, just waiting. Did he post to one of his alt-right media sites? We'll take his video down. Oh. Sir, boss, he's posting to the effing CDC.gov website. The authority source. Above our fake authority sources that we push above everybody else, MSNBC, CNN, you know, NBC. This is the CDC.gov he's quoting. How are we going to take his video down? He's going to quote verbatim. Well, just see if he says one thing out of line. If he says one thing out of line, then nail him. Take his video down. Well, let's see what happens here. The CDC, this is from the conservativereview.com website, but they're going to put a link up where they get the data from the CDC. So it's in the article. The CDC link is right there. CDC confirms not just low coronavirus death rate, remarkably low coronavirus death rate. Where is the effing media? And as I'm about to read you this, I want you to understand something that you can go easily find right from the same CDC data I've been telling you all about over these last few months. How many coronavirus only deaths exist? We don't know, because we've been lumping them in with other deaths per our own guidelines, and actually advising the hospitals and everyone to, more likely than not, put COVID as the reason on the death certificate as opposed to any underlying condition, because our guidelines say to do so. And the hospitals obliged with a smile on their face. Again, they were saying that through Medicaid, due to this outbreak or whatever the hell you want to call this thing, if someone dies in your hospital, the price ranges apparently, but on average, I guess $13,000. Just write that name on a death certificate, $13K coming your way. Oh, they needed a ventilator? 30-something thousand. 39,000, 33,000, whatever. It varies. So if you have the old jabroni on the deathbed, can't pay their bill, I know they have the flu, or I know they have pneumonia without a doubt. We ain't getting paid. All I have to do is just write the words Corona, COVID-19, and I can get paid? What do you think's been happening? Anyways, the other issue, which I set myself to do a video, and I was like, I kind of want to leave this alone. I kind of want to leave it alone, but I said it to myself anyways. I didn't do the video. But the video was going to be, and this is a United Kingdom article from the Telegraph or something over there. And they said, oh, listen, about those deaths, corona deaths. How do we say this? Pull that down a bit. Listen, you're gonna laugh your butt off. What had happened was we've been double counting the deaths. Yeah, just a silly mistake, an accounting error. Not really. We've been taking a nasal swab in a mouth saliva swab. Two separate swabs. One goes to one laboratory, the other goes to another laboratory, and the laboratories didn't know that we were doing that per single patient. So 2 test kits were essentially going out, both coming back positive if the person was positive, counting them as 2 different people when it was the same person. Oops! Sorry about that. Again, I was going to do the video. Do I still have it in my email? Because if it's here, and I'm on the subject anyways, rather than just tell you what I was going to say, I'd like to maybe show you. Theta, Google Drive takes down personal copies of Judy Mikovits. Yep. Creepy Ellen DeGeneres video with a weird thing in the background. Yeah, I didn't do that one yet. Ballot problems. Oh, there it is. Oh, here we go. Telegraph.co.uk. Let's cover it. We're on the subject. Tens of thousands of coronavirus tests have been double counted, officials admit. 2 samples taken from the same patient are being recorded as 2 separate tests in the government's official figures. Oh, gosh. You would just think it's just, I don't know, one mistake after another, after another, after another, after another. Remember, I brought it to you. Oh my gosh, UK. The test kits are contaminated. Here's the official story. The government agrees. Yes, that happened. We're gonna. They said, well, there's one key element to all the test kits. So even though this is vendor A, Vendor B, C, D, E, F, and G, you guys all have that same piece in your test kits. They're all contaminated. What do you mean? By contaminated with what? Dirt? Some like unclean environment? No. Contaminated with the virus itself. Oh, so the test kits are going to test positive. Yeah, essentially. And then we found out on this side of the pond, at the CDC, 3 of the labs, 2 out of the 3, contamination again, test kits. You know, incompetent, we didn't know. Or is there something else going on? Is this about a virus? Or is this about the election? Mail-in ballots. Whoa, guys, we got time. November's a while away. Democratic governors, we got time. We got time. Why are you in a hurry for? COVID's going down. You could be able to go right out and vote. Matter of fact, ask the governor of Virginia. He's out mingling with the people. If I could go into Costco, I could go into public supermarket, Walmart, Home Depot with people all around me. Well, gosh, it seems like I could probably go anywhere where there's some people around me, including the small restaurant that has far less people in it than Home Depot, Walmart, any of those places. Well, you know, again, flatten the curve. Hey, you're not wearing a mask. You're not wearing a mask. I wish some liberal lunatic would walk up to me anywhere I've been and even look at me the wrong way for not wearing a mask. So back to the original news article from the CDC, brand new update, very recently. The CDC just came out with a report. Again, I'm looking at the mouse here. Watch the screen. Watch the screen. Hover the mouse. Look at the bottom left corner of the screen, way down the bottom left. cdc.gov/coronavirus/2019 planning scenarios. Okay, it's their new data report. The CDC just came out with a brand new report, that should be earth-shattering to the narrative of the political class, yet it will go into the thick pile of vital data and information about the virus that is just not getting out to the public. For the first time, the CDC has attempted to offer a real estimate of the overall death rate for COVID-19 and under its most likely scenario. And remember, by the way, stop, pause. Every model we got has been wrong and not even kind of close. On another planet, light years away, wrong. That's how bad it's been. As far as the data. How bad their data. Well, it's going to be horrible. No, it's not. 500,000 million deaths. 500,000 deaths in America. No, it's not. No, it's not. I got the thing saved in my email. Remember, I said, guys, I got it. May 5th. Watch this. Boom. I showed it to you guys. And it's under its most likely scenario, the number is 0.26%. And again, when I read you these numbers, we're double counting, although not necessarily deaths double counting, but we do know the deaths are usually, they had an underlying condition, and that was the main reason. And if you look at how many people have died, the majority are like nursing home patients. They're elderly, they're sick, they've got problems, and well, again, just write down COVID. They may have had underlying stuff. Doesn't matter. We're writing down COVID. So keep that in mind as I read you these stupid, ridiculously known numbers anyway. You just want to write, forget the whole COVID, they had an underlying condition. Let's pretend they didn't have an underlying condition. Let's just go with the numbers now. Officials estimate that a 0.4% fatality rate among those who are symptomatic and project a 35% rate of asymptomatic cases among those infected, which dropped the overall infection rate, or IFR, to just 0.26%. Almost exactly where Stanford researchers pegged it about a month ago. Until now, we have been ridiculed. I don't need to show the screen. I don't even want to see me up close and personal. Got a face only a mother could love. Mama, ooh. I didn't mean to make my YouTube subscribers cry. Until now, we have been ridiculed for thinking the death rate was that low, as opposed to the 3.4% estimate, again, of the who? Speaking of who, WHO, World Health Organization. The 3.4% estimate of this multi-billion dollars we give away constantly to the World Health Organization. Here you guys go. Oh, you need more money? Here. Oh, buckets full. I got singing bowls full. Here. Dump it. Oh, you need more? Here. China, you're not paying enough? That's all right. My buddy America's got it. F those guys. Here you go. There you guys go. For your unbelievable false crap data. Remember again, I think it was Zika virus or Ebola. I think it was Zika. It was one of the ones several years ago, maybe 2010, something. Oh my God, we have level 1, 2, 3, 4, 5, 6 on the World Health Organization pandemic scale. Mass panic, worldwide epidemic. If we hit level 6, it's, Black Plague. And they declared level 6. Oh my God, worldwide. Nothing happened. Few thousand dead. Okay, see you later. So that organization, failure after failure after failure. Again, we have to ask, is it really a failure? Like, they just made a mistake, a little bit of incompetence, a little bit of... or is there a freaking agenda? You can't get it wrong this many times, this many years, people. They said 3.4% would be the death rate. World Health Organization, which helped drive the panic and the lockdowns. Now the CDC is agreeing to the lower rate in plain black and white paper and ink. Plus, ultimately, we might find out that the IFR is even lower because numerous studies and hand counts of confined populations have shown a much higher percentage of asymptomatic cases. Simply adjusting for a 50% asymptomatic rate would drop the fatality rate to 0.2%. Exactly the rate of fatality Dr. John Ioannidis of Stanford University had projected. More importantly, as I mentioned before, the overall death rate is meaningless because the numbers are so lopsided, given that at least half of the deaths were in nursing homes. A back-of-the-envelope estimate would show that the infection fatality rate for non-nursing home residents would only be 0.1%, or 1 out of 1,000. And that includes people of all ages and all health statuses outside of nursing homes. Since nearly all of the deaths are those with comorbidities, the CDC estimates the death rate from COVID-19 for those under 50 is 1 in 5,000 for those with symptoms, which would be 1 in 6,725 overall. But again, almost all those who die have specific comorbidities or underlying conditions. Those without them are more likely to die in a car accident. And school children whose lives, mental health, and education we are destroying are more likely to get struck by lightning, according to statistics. To put this into perspective, one Twitter commentator juxtaposed the age-separated infection fatality rates in Spain to the average yearly probability of dying of anything for the same age groups, based on data from the Social Security Administration. He used Spain because we don't have a detailed infection fatality rate estimate for each age group from any survey in the U.S. However, we know that Spain fared worse than almost every other country. This data is actually working with a top-line IFR of 1%, roughly 4 times what the CDC estimates for the U.S. So if anything, the corresponding numbers for the U.S. would be lower. And he wrote, being alive means there's a risk that you will die in every year of your life. Normally, we don't think about this because the probability is very small. It turns out that even if you're infected with COVID, your increased risk to die versus normal is not very large at all. And he has a screenshot here, which we'll make big and share. COVID average yearly probability of death, period. So look at these numbers. These are the two numbers, basically, because they're adding these. So 0.073% or 0.075%. I mean, Jesus, it's the same. This one, 0.614, 0.75. And this is 50 to 59 age group now. 60 to 69, 1.2% versus 1.7%. 70 to 79-year-olds, 3% to 4.6%. Again, the increase, as it says here to the right, increased yearly probability. And while these numbers, 27% increase, man, that's huge. Whoa, 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 whoa. The overall percentage is stupid low. Yes, from 1.2 to 1.7, yes, it's 27%. It's still 1 point something percent, period. Nothing. It's a nothing burger. So as he says, as you can see in even Spain, the death rates from COVID-19 for younger people are very low and are well below the annual death rate for any age group in a given year. For children, despite their young age, they are 10 to 30 times more likely to die from other causes in any given year. 10 to 30 times. While obviously yearly death rates factor in a myriad of causes of death, and COVID-19 is just one virus, it still provides much needed perspective to a public policy response that is completely divorced from the risk for all but the oldest and sickest people in the country. When you quarantine healthy people, you're in a dictatorship. When you quarantine the sick people, you're in a democracy. Take care.